I'm going to do an article review today, one that I saw in PubMed from knee surgery, sports traumatology, arthroscopy, published just late last year, 2024, July 2024. Looking at the subjective grade of apprehension test during a pivot shift test. I don't know how many people use it. I do occasionally with acute ACL tears, and then would follow up with ACL patients even further down the road to see if they have anterior lateral rotary instability, which would indicate some degree of at least rotational instability that we think may affect their outcomes. And this study looked at investigating whether the pivot shift test done conventionally, which is based on what you feel, is similar to the patient's subjective, what they feel when you do the test. So they included patients who underwent ACL reconstruction with hamstring tendons. They graded the pivot shift according to the IKDC, which is 0, 1 plus, 2 plus, or 3 plus, based on the amount of instability you feel with your hands when you're doing the test. And then also based it on the patient's subjective apprehension during the pivot shift test. 0, no apprehension, 1 plus mild apprehension, 2 plus moderate apprehension, 3 plus severe apprehension. And they said a positive pivot shift in this test was a 1 plus or more. They had 837 patients that they checked at 1 year post-operatively. They also looked at KOOS scores, IKDC scores, and Leischel and Tegner activity scales. They had 118 patients who were positives who had at least a 1 or more pivot shift subjectively or objectively on just the conventional pivot shift testing. When they initially looked at the patients using the conventional pivot shift test, there wasn't a difference between the two groups in the scores. However, when they looked at the conventional, when they looked at the people that had a positive pivot shift test, what they found was that those in the apprehension positive group had less positive scores. They had lower scores on the Tegner, the KOOS symptoms, and quality of life subscales. So patients, if you look at the pivot shift and subjectively, based on patient's apprehension, there's a significant association with postoperative Tegner activity scales, subscales of KOOS, maybe indicating that there's some apprehension in their ability to return back to sports. And this should not probably be much of a surprise for us because we have other instability tests that we use. We have examination tests for elbow instability, the O'Driscoll test, looking at posterior lateral rotary apprehension in the elbow. We have the Fairbanks test, which is a patellar apprehension test. And so there's probably no reason we can't look at pivot shift testing and using the subjective outcome of it to determine how your ACL patients are feeling subjectively. So to conclude, they said the patient's subjective apprehension during a pivot shift test after ACL reconstructions, this was 1 year, significantly associated with postoperative Tegner activity scale and 3 subscales of the KOOS. However, there's no association between the conventional IKDC grading of the pivot shift test and any patient-reported outcomes. Thanks for listening.